Assalamualaikum and hi everyone. Here is our vlog regarding HIV. So what's with HIV? Let's enjoy our video.
Hello, for the introduction, I'm going to explain what is HIV, what is AIDS, and the relationship of HIV and AIDS. HIV, or known as human immunodeficiency virus, will attack the body immune system. It can be transmitted through body fluid exchange and during pregnancy. It can lead to AIDS if it is not treated. Besides, HIV can be controlled even though there is no cure. So what is AIDS? It stands for Acquired Immunodeficiency Syndrome. It is not inherited but can be transmitted from infected person to a healthy person. Besides, it weakens or damages the immune system as it creates a CD4 plus deficiency in the immune system. Next, I'm going to talk about the relationship of HIV and AIDS. There are three stages of HIV. The first one is acute HIV infection, which is very contagious. The second stage is chronic HIV infection, which it is asymptomatic. And the last stage is AIDS, where the immune system is badly damaged.
The signs and symptoms of HIV infection vary depending on the stage of infection. In the first few weeks after initial infection, people may experience no symptoms or an influenza-like illness including fever, headache, a rash or sore throat. As the infection progressively weakens the immune system, they can also develop other signs and symptoms including swollen lymph nodes, weight loss, fever, diarrhea and cough. Factors that put individuals at greater risk of getting HIV infection include having unprotected anal or vaginal sex, having another sexually transmitted infection, sharing contaminated needles, syringes and other injecting equipments and drug solutions, receiving unsafe injections, blood transfusions and tissue transplantation, and those who involve in medical procedures that involve unsterile cutting or piercing, and those who experience accidental needle stick injuries, including among health workers.
I'll explain the pathophysiology of HIV infection, which begins with attachment and ends in the budding of mature infectious virions. The mechanism begins with the attachment of viral envelope to heparan sulfate proteoglycans. Following this, specific binding between glycoprotein 1,2,0 and CD4 binding site occurs. This prompts the binding of chemokine receptors to the virus that causes conformational alteration of the virus. Now the virus is able to fuse with the host cell surface and release its genome into the cytoplasm. Following this, the viral will be able to invade the host cell DNA.
Invasion of host DNA begins with the reverse transcription of viral RNA into DNA. Then integration between viral genome and host chromosomal DNA occurs. This results in the generation of viral proteins. Viral protease enzyme then cleaves the viral protein to form mature infectious virions. Finally, mature infectious virions buds out of the CD4 cells and the infection cycle continues.
Hello everyone, so now let's talk about the treatment of HIV and AIDS. Currently, there's no cure for HIV and AIDS. Once you've been infected, your body can get rid of the virus. However, there are many medications that can control the HIV and prevent the complication. These medications are called antiretroviral therapy. The classes of anti-HIV drugs including non-nucleoside reverse transcriptase inhibitor, nucleoside or nucleotide reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, and lastly, entry or fusion inhibitors. So how do HIV medicine works? HIV medicine prevents HIV from multiplying, which reduces the amount of HIV in the body. Less number of HIV in the body give the immune system a chance to recover and produce more CD4 cells. HIV medicines also reduce the risk of HIV transmission. The main goal for HIV treatment is to reduce a person's viral load to an undetectable level, where the level of HIV in the blood is too low to be detected by the viral load test.
I'll talk about current medical view regarding HIV infection. After 40 years, HIV infection has changed from being a fatal disease in vast majority of cases to chronic infection. According to the latest UNAIDS report, 37.9 million people were living with HIV infection globally in 2018. There has been steady decline from the number of new infection in 2018. In 2014, UNAIDS has set the target to end the AIDS of epidemic by 2030. However, in 2016, the statistic of HIV infection shown successful and the chances chances to achieve the target is high. Victoria Hernando stated that the eradication of HIV is an unachievable goal in near future, but it can reduce the incidence of cases to zero through modes of transmission. Beatrice's mother explained that there is no vaccine of HIV due to difficulties in vaccine development. These include viral load density, viral reservoir, and relative degree of immunodeficiency people with HIV infection. Mayakara said that the immunotherapy should be considered as a very important tool for the control of HIV infection.
That's all from us. Thank you for your time and thank you for listening. With that, we thank you.